Welcome to the culture of healthcare. So, in this series, we're shining the spotlight on biomedical equipment technicians and clinical engineers and the critical role that you play in modern medicine. And here's what we'll dig into. So, what's expected of you in today's healthcare settings and how your work directly supports both clinicians and patients, right? That's why you're called clinical engineers. How care is organized in hospitals, clinics, and other facilities, and where HTM professionals or healthcare technology management professionals fit into that whole structure. We're going to look at the impact of privacy laws like HIPAA, if you've not heard of that, because data protection and device security are as important as the devices themselves, and the professional and ethical challenges that you're going to face balancing cost, safety, efficiency, and compliance while keeping patient care at the center of everything. And the key takeaway that you should get from this one series here, podcast series, is that you're not just in charge of ensuring that equipment is maintained and fixed. You're making sure that the devices that the clinicians rely on are safe, effective, and trusted. So every system that you help maintain directly impacts patient safety and the confidence that care teams place in their technology. Okay, so let's talk about what we're going to cover in this podcast, right? So, healthcare settings, again, the place where care is delivered. We're going to first differentiate the range of care delivery organizations, including primary care, specialty care, tertiary care, hospitals, clinics, the medical home, which I think might be called the quaternary care, the fourth level of medicine, home health care, in some textbooks. So, home health, hospice, long term care facilities. And then we're going to describe the roles of BMETs and clinical engineers in supporting safe, reliable technology across all of these environments. Then we're going to analyze the organization of healthcare delivery from the perspective of a continuum of care, right? So, including outpatient services, inpatient services, home care services, long term care, and end of life care, and explain how HTM professionals ensure that the technology transitions smoothly and supports patient at every stage. Then we're also going to evaluate the similarities and the differences of community hospitals, teaching hospitals, specialty hospitals, and community health clinics and compare how clinical engineering practices adapt in these settings to meet diverse technical, regulatory, and patient care needs. Continuing with the additional objectives for the unit are going to be number 4 to describe the various departments and services offered by an outpatient clinic, community hospital, academic medical center, and long term care facility. And we're going to identify how BMETs and clinical engineers support these environments by maintaining, integrating, and adapting medical technologies. Number 5, explain the ways in which different outpatient and inpatient departments interact and how their services are related, with some specific attention to how HTM professionals ensure interoperability, safety, reliability of technology across these departments. Then we'll look at describing ways in which data and information are created and used by people in different outpatient and inpatient departments, and explain the role of HTM in ensuring that the connected devices, the EHR integrated systems, and monitoring technologies accurately capture and transmit this data. And then ultimately, number seven, describe ways in which medical and information technology have improved interdepartmental communication and the patient experience. And we're going to take a look at and evaluate how BMETs and clinical engineers contribute by managing device connectivity, supporting health IT integration, and ensuring technology enhances safety and workflow efficiency. Hello, and you're listening to a podcast on the culture of healthcare and healthcare technologists. So, in this lecture, we're exploring the landscape of healthcare provider organizations, their settings, the levels of care they provide, and the critical roles they play across patient continuum of care. Now, what do we mean by continuum of care? It's the idea that an integrated system guiding and tracking the patient over time through a full spectrum of health services from birth to the end of life, um, in every setting, whether it's a hospital, physician's office, outpatient clinic, home health, hospice, or medical home, it has a place in that continuum. And the goal is to deliver safe, effective, and consistent care across every transition. But here's where clinical engineering comes in. Across every one of these organizations, patients and clinicians are relying on technology. They rely on devices, systems, and networks that make modern medicine possible. And who makes sure that the technology is safe, reliable, and trusted? Well, uh, biomedical equipment technicians and clinical engineers. So without them, the continuum of care breaks down, not because of people, but because the tools can't be trusted. So, as we explore the unique functions of these healthcare organizations and how they interconnect, remember technology is already woven through all of it. And clinical engineering is the quiet force ensuring that every level of care is supported by systems that work. If you want to get the big picture of healthcare delivery, the best place to start is by looking at the range of services that different organizations provide. So, if we're looking at primary, secondary, tertiary care, within primary care, this is usually the entry point. It's your first stop for healthcare. From there, patients may be referred on. Right. Secondary care is most often specialty care. Think like cardiologists, dermatologists, orthopedists. Tertiary care goes even further. These are the advanced centers that offer highly specialized diagnostic and treatment that you're not going to find at most facilities. And this is how it all connects. So, primary care can refer patients to either specialty care or directly to tertiary care. And secondary care providers can also refer directly to tertiary care. It's a system of steps, each level designed to handle more complex cases as needed. But just remember, none of this works without technology. So, whether it's a basic diagnostic tool in primary care, advanced imaging in specialty clinics, or cutting edge surgical systems in tertiary centers, technology is already woven through every level. And who ensures that that technology is safe and reliable and ready when it's needed? Well, you know it already, the biomedical equipment technicians and the clinical engineers. The continuum of care isn't just about people and referrals. It's powered by technology. And at every level, the clinical engineer is the invisible backbone, making sure those systems deliver when patients need them the most. Primary care is where it all begins. It's designed to address the majority of a person's health needs, so screening, prevention, diagnosis, and treatment for both acute and chronic conditions. It's meant to be accessible, it's sustainable, and for most people, it's the entry point into the healthcare system. You'll find primary care in physicians' offices, practices, right, like in local clinics and in public and community health centers, especially for underserved populations. But here's the piece that often goes unnoticed. Technology supports every step, from basic diagnostic tools to electronic health records to the monitors and devices in clinics. Technology makes primary care reliable. And it's the biomedical equipment technicians and clinical engineers who keep that technology safe, calibrated, and ready. Primary care is the front door to healthcare, and HTM, healthcare technology management professionals, make sure that the door stays open, make sure that it's safe, dependable for every patient who walks through it. Secondary care is where healthcare starts to get more specialized, and that's why it's called specialty care. So here, patients can access services like surgery, cardiology, rehabilitation, burn care, and a whole lot more. Secondary care providers come in many different forms. So you can have ambulatory care facilities where outpatient surgery centers and rehab facilities exist. You can have hospitals, from community hospitals to large academic medical centers. You can also have specialty hospitals like cancer-focused institutions or even pediatric hospitals. You can have home care and hospice services, and you can have extended care facilities. This is things that include nursing homes, skilled nursing facilities. But no matter the setting, technology is at the core. Whether it's surgical robotics in an ambulatory surgery center, infusion pumps in a cancer hospital, or monitoring systems in skilled nursing facilities. Here's where clinical engineering comes in. Right? BMETs and clinical engineers make sure those technologies are safe, reliable, and integrated into patient workflows. Without that support, the very systems secondary care relies on could fail. Secondary care delivers specialized services across a wide range of facilities, and clinical engineering is the unseen force that ensures The technology behind the care is dependable, efficient, and patient safe. Tertiary care is the peak of specialization. These centers provide treatments you won't find anywhere else. Procedures so advanced they're often perfected in only a handful of organizations. We're talking about complex facial reconstruction, organ transplants, or highly specialized burn care. These are the places where medicine pushes the boundary. Often they're large academic hospitals or integrated delivery systems that serve as tertiary care centers, and they bring together highly skilled clinicians, cutting edge procedures, and the most advanced technologies available. And here's the main key point: none of this is possible without technology and without the clinical engineers and BMETs who ensure it works. From organ transplant monitoring equipment to advanced imaging, surgical robots, HTM professionals keep these high stake systems safe, calibrated, and reliable. Tertiary care represents like the frontier of modern medicine. Clinical engineering makes sure the technology that is at that frontier performs flawlessly because in these settings, there's no room for failure. Many healthcare organizations aim to cover the full spectrum of patient needs by creating integrated healthcare delivery systems. And sometimes this looks like an informal association, primary care providers linked with local hospitals or medical centers. More often, it's a formal network where primary, secondary, and tertiary services are all managed under a single umbrella. These systems can be highly localized, serving a single community, or they can extend across regions, nations, even international borders. Clinical engineering plays a critical role here. In integrating networks, technology has to be consistent, safe, and a big word here is interoperable. It has to be interoperable across every setting, whether it's a community clinic, specialty hospital, or a large academic center. BMETs and clinical engineers make sure devices and systems can work seamlessly across these networks so that patients experience a good continuity of care and they have also no gaps in the safety throughout that continuity of care. Integrated delivery systems bring together multiple levels of care under one structure. Clinical engineering just ensures that the technology that connects those levels is reliable, safe, and ready, no matter where the patient enters the system. The patient continuum of care is the idea that health services follow a person across their entire journey, so from birth to death. Different providers step in at different points depending on the patient's needs, and the goal is always the same: restore function and quality of life or provide support until care is no longer required. Imagine a patient in a serious car accident. They may need emergency care to stabilize, surgery to repair injuries, and rehabilitation to regain function. In an integrated delivery system, all those services could be coordinated under one network, keeping the patient's journey smoother. In other cases, patients might need to move between multiple organizations to piece together the care that they need. But here's the thing: every step of that continuum depends on the technology. Emergency monitors and ventilators in the ER, surgical equipment and imaging in the OR, infusion pumps, rehab devices, and even telehealth systems during recovery. And that's where biomedical equipment technicians and clinical engineers come in. Your work ensures that each point along the continuum, the technology is safe, reliable, and integrated, so the focus stays on healing, not on troubleshooting. The continuum of care isn't just about moving between providers, it's about making sure that the technology works seamlessly across every stage, and clinical engineering is what makes that possible. And just to throw one more little piece of useful information going back to a serious car accident, the continuum of care, the interoperability of medical devices, and the information all consolidated in one place would probably help the patient present this information to an attorney in case they had to, seek legal actions outside of healthcare. So one discipline, profession, healthcare, helping another, the legal system. Let's talk about ambulatory services, also known as outpatient care. And these are services provided to non hospitalized patients, and they cover a wide range of health needs. Think of what you can find in an ambulatory setting. So, primary care in a doctor's office or clinic, we have outpatient surgery centers, sports medicine, sleep labs, physical and occupational rehab, lab services, radiology services that includes both MRI and CT, and ambulatory care. All that keeps expanding. Right? Some organizations now run wellness centers focused on prevention and education. Others are just setting up retail clinics and pharmacies and big box stores. They provide flu shots, basic care, and non-emergency services, often in partnership with local health systems. Right? You might have seen this at your local uh, pharmacy. I'll try not to mention an actual company. I'll just stay out of that. But go to your local pharmacy and you'll see that they do a whole lot more than just provide fill prescriptions. Right? They do some basic care, flu shots, COVID shots, all that kind of stuff. Public health departments also run outpatient clinics for community care. Every one of these outpatient environments relies on what? Technology. They rely on diagnostic imaging, lab analyzers, rehab equipment, infusion systems, even point of care devices and retail clinics. So, BMETs and clinical engineers make sure this tech is safe. Every one of these outpatient environments, again, relies on all this technology to be calibrated and dependable, even in high volume outpatient settings where downtime isn't really an option. Ambulatory care is where more and more patients are receiving services nowadays, and clinical engineering is what ensures the technology in those outpatient spaces is ready, reliable, and trusted. Ready, reliable, and trusted. Yeah. Let's talk about the patient medical home model. So, this is a primary care approach built around being patient centered, comprehensive, being team based, coordinated, and most of all, accessible, right? With a strong focus on quality and safety. It's not a physical place, it's a model, one that's become widely accepted across health systems as the gold standard for how primary care should be organized. The idea is simple: meet patients where they are and deliver care in the right place at the right time in the way that best fits their needs. And what are the benefits to this? Well, you should get improved quality and safety. You should see stronger integration of patients and families into decision making. You should see care that feels more personal, that's coordinated and connected. And for models like this to succeed, technology has to be reliable and integrated. From EHR systems and telehealth platforms to diagnostic tools in the clinic, you have technicians, BMETs, and clinical engineers that make sure the tech behind all of this accessible, coordinated care is safe, secure, and dependable. The patient medical home model strengthens the bond between patients, families, and providers. And the clinical engineering ensures that the technology supporting the bond is seamless and trustworthy. So, again, depending on the textbook that you may see, this patient model, the home model, may be referred to as like the fourth tier of healthcare: primary, secondary, tertiary, and then the quaternary. Um, or it just may be labeled as a home model. For decades, most medical treatments have been designed as a one size fits all approach, right? Not even decades, centuries, I should say, not decades. And we've been slowly moving away from that. And while that does work for some patients, it doesn't work for everyone. And that's where precision medicine, sometimes called personalized medicine, comes in. It's an innovative approach to disease prevention and treatment that considers differences in a person's their genes, their environment, their lifestyle, because all of this actually plays a part in their healthcare and in their healing, right? And so the impact of this is real and it's observable. Advances in precision medicine have led to powerful new discoveries and the FDA approved treatments that are tailored to individual characteristics. So, patients with cancer, for example, often undergo molecular testing so physicians can choose treatments that improve survival rates and minimize harmful side effects. I remember working on these technologies when it was still in research and it hadn't moved to medicine yet. But now we see molecular medicine departments in hospitals, or it might not be called that, but it's basically that's what it is. Same devices that we worked with in research that are now just there in mass scale in healthcare. Yeah, precision medicine depends on reliable technology, just like in research, molecular testing platforms, genetic sequencing machines, high performance imaging machines, and beneath all of that, the IT infrastructure that ties it all together. And whenever we talk technician and technology, right, we're dealing with the electronics of these devices, and that's where BMETs and clinical engineers ensure that these advanced systems are calibrated, maintained, and they're integrated safely into the clinical workflow. And without that support, the promise of precision medicine, the promise of safe precision medicine can't be realized. And precision medicine is transforming care by tailoring treatments to the individuals. And clinical engineering ensures that the technology behind that transformation is accurate, safe, and ready to serve patients. Community health clinics play a vital role in providing care to underserved populations, and many of these are federally qualified health centers, right, or FQHCs, for if you want to know another acronym. Right? To earn that designation, they have to meet strict federal qualifications, and FQHCs include things like community health centers, migrant health centers, programs serving the homeless, and public health primary care programs. There are also lookalike clinics, right? These don't receive direct grant funding, but they're certified as meeting the same definition of a health center and can still access many of the same benefits. Some clinics are operated by tribal organizations, and they're supported by things like the Indian Health Service, for example. Others are run by nonprofits, profits. They're county hospitals or their city health departments, right? And that's it. That's where the clinical engineering comes into play. Is that even in resource limited settings like these, patients they'll still depend on reliable technology. Everything from basic diagnostic tools and lab equipment to infusion pumps, and obviously the big push for the EHR linked devices. BMED's clinical engineers have to ensure that these systems are maintained, safe, functional, and when you're dealing with underserved communities where resources are tight, keeping that equipment reliable isn't just a technical task. It becomes a lifeline for healthcare for for these communities. So community health clinics extend care to populations who need it most, and clinical engineering just makes sure that the technology behind that care is accessible, safe, and dependable, no matter where the clinic is or who it serves. And this particular area of community health reminds me of some of the origins of clinical engineering, prior to the Gilded Age and post Gilded Age times. School based health centers bring care right to where kids spend their days, right inside the school itself. And these centers provide a wide range of services depending on state and local policy. Most often, they focus on screening, preventive care, and treatment for minor injuries or illnesses. Some also offer behavioral health services and counseling. And when students need more advanced or specialized care, these centers typically have referral arrangements, both formal and informal, with local hospitals and clinics. Even in these smaller community based health centers, technology matters. So, blood pressure monitors exist, diagnostic equipment, we have plenty of point of care testing devices, and some telehealth links back to local hospitals. And all of these have to be reliable and safe. Right? BMET's clinical engineers they ensure that this equipment works properly. So the focus stays on keeping kids healthy and in class. School-based health centers, what they do is they extend the continuum of care directly into the classroom. And believe it or not, clinical engineering helps make that possible by keeping the tools safe, dependable, and connected to the larger health system. Um, it's really hard not to feel so proud to work in clinical engineering, knowing where our technology actually reaches. It reaches so far. And I'll try not to turn this podcast into a marketing thing for clinical engineering, but it's a great field. Employer-based health clinics have come a long way in the past few decades. Right? I would say the last, yeah, I'll keep it as decades. I was going to say half a century, not a whole century. Maybe. Anyway, they began with a focus on occupational health and injury prevention. Again, keeping workers safe on the job. But today, many have extended into preventive care, screening, wellness, and even chronic disease management. Some of them will do preliminary screening prior to being hired. Right? And so these clinics can be located right on site in an employer facility, or they might be mobile clinics that serve multiple locations. For employers, the benefits are pretty clear: controlling healthcare costs and giving employees access to care without losing productivity to time off. And the model is growing. So you have a survey that found in 2015, 29% of organizations with more than 5,000 employees offered worksite clinics, up to that was up from 24% just 2 years earlier than that. Um, so even in employer-based clinics, technology is everywhere. From again basic diagnostic equipment, lab analyzers, telehealth links, to mobile medical units packed with tons of devices. BMS clinical engineers play a critical role in ensuring this equipment is safe, reliable, and ready to move with the workforce. Remember, the technology has to be seamless, it has to feel invisible, it has to be where it doesn't interfere with the actual healthcare at all. So, employer based clinics are becoming a bigger part of the healthcare landscape, helping reduce costs, increase access, and clinical engineering make sure the technology behind those clinics works and help keeping employees healthy and keeping the business productive. Again, this reminds me again of how the origins of clinical engineering arose prior to the Gilded Age, during the Reconstructive era, uh, before and after the Civil War. We didn't have a term called clinical engineering, but technology was already making its way into healthcare. Inpatient care refers to health services that require a hospital admission, typically for more than 24 hours. So, as one definition puts it, hospital services means the medical and surgical services and the supporting labs, equipment, and personnel that make up the mission of a hospital or hospital system. So, emergency care, operating rooms, intensive care units, imaging, lab testing, pharmacy service, all the support functions that keep patients safe around the clock. Every one of those services depends on technology. They all depend on a backbone infrastructure for information technology. They also depend on life saving devices like ventilators in the ICU, surgical devices in the OR, diagnostic imaging systems, infusion pumps, patient monitors, and really, really important sterilization equipment. BMETs and clinical engineers have to ensure that those systems are reliable, calibrated, safe, so hospital teams can focus on the patient, not the machine. Again, they shouldn't have to be worried about the machine. The machine should integrate flawlessly within their healthcare process. We should be invisible. It should seem like we're not there at all, and it should be that seamless. Inpatient care is the heart of hospital medicine. Clinical engineering is the unseen force that keeps that heart beating by making sure the technology behind the hospital services never misses a beat. Hospitals generally fall into two big categories: community hospitals and teaching hospitals. Well, community hospitals are non federally funded and can be either nonprofit or for profit. They're usually local, providing short term general care, but many also run specialty units focusing on things like obstetrics, gynecology, orthopedics, or rehabilitation. Teaching hospitals, also called academic hospitals, are typically tied to universities or medical schools. Their mission goes beyond care. They're also centers for training health professionals and advancing medical knowledge. Interestingly, the range of clinical care in both community and teaching hospitals can look very similar. And there's a third group worth noting: specialty hospitals. And these focus solely on a specific population or a disease state like cancer, pediatrics, rehabilitation, diabetes. Some are part of a larger health system, while others operate independently as nonprofit or for profit organizations. But no matter the type, community, teaching, or specialty, hospitals rely on medical technology, from basic monitoring equipment in a local community hospital to cutting edge robotics and imaging in a teaching facility. BMETs and clinical engineers ensure that every device is reliable, safe, and ready to serve. The type of hospital may vary, but the role of clinical engineering doesn't change. Across all settings, HTM professionals keep the technology trustworthy so patients and clinicians can focus on care. In the US, most hospitals are privately funded community hospitals. So these provide acute care, short term treatment for serious injuries or illnesses, and they're not typically affiliated with federal, state, or local governments. But the system is diverse. The US also has a significant number of psychiatric hospitals, along with hospitals funded by the federal government, like the VA hospitals that are serving veterans. And for patients who require extended stays, there are long term care hospitals and facilities designed for those who need 25 days or more of inpatient care. Each of these hospitals, community, psychiatric, government funded, or long term care, depends on technology tailored to its patient population. BMETs and clinical engineers ensure that everything from ventilators and imaging devices to psychiatric monitoring tools and long term infusion systems are reliable, safe, and ready for use. Hospitals may differ in funding and focus, but the demand for safe, effective technology, that's constant. Clinical engineering is the common thread that keeps patient care possible across every type of hospital in the US. Long term care facilities are designed to support aging adults and those living with chronic illness, and they come in many forms depending on the level of support required. So, we have adult daycare. They offer meals, activities, and supervision during the day while clients return home at night. You have independent living communities. These are often retirement campuses with separate apartments or condos. Residents live independently but can add on services like meals or housekeeping when they choose. You have assisted living. This goes a step further, providing individual rooms or apartments with services built in. That might include personal care, medication administration, meals, housekeeping, all part of the package. Even in long term care, technology is essential, whether it's vital signs monitors in adult daycare, medication dispensing systems in assisted living, or safety devices like fall alarms in independent living. BMETs and the clinical engineers, they have to ensure that these technologies are reliable, safe, and properly maintained so residents receive consistent quality care. Long term care facilities may look different daycare, independent living, assisted living, but in every case, technology underpins safety and support. Clinical engineering makes sure that technology does its job so caregivers can focus on people. I want to make sure I make one more thing clear. It doesn't mean that the clinical engineer is the individual who's um, you know, opening up the device and checking it for safety. There's a whole system in place for that, but clinical engineers are ultimately responsible for that system to function. Let's look at two important parts of the long term care facility skilled nursing facilities and long term care hospitals. So, within skilled nursing facilities, they provide full medical care along with support of daily living, things like meals, personal care, housekeeping, laundry. They're designed for patients who need both medical oversight and some everyday assistance. Long term care hospitals, they're a little bit different. They focus on managing the transition from an acute illness or injury back to home. And many community hospitals even have dedicated long term care units, and that's where the key distinction is. The average patient stay is greater than 25 days. These environments rely heavily on technology, things like patient monitors, they may have infusion pumps, they may use ventilators, rehabilitation equipment for sure, and even automated medication systems. And it's up to the BMETs and clinical engineers to make sure that these devices are dependable over long stretches of care where reliability is critical and downtime could mean delayed recovery. Skilled nursing and long term care hospitals, they bridge the gap between hospital and home. So clinical engineers ensure the technology in those settings is safe, reliable, and ready for the long haul. Again, I just have to add one more thing. It doesn't mean that these BMETs and clinical engineers are located within the facility itself, but they are at some point, they are a part of that process. Home healthcare brings treatment directly to the patient's home. It's often less expensive, it's more convenient, and for many, a safe, effective alternative to hospital care. The ultimate goal: treat the illness or injury and help the patient regain independence as quickly as possible. So they deal with things like wound care for pressure sores or surgical wounds. They can deal with patient and caregiver education, intravenous and nutrition therapy, medication administration and injections. They can be part of monitoring chronic illness or some unstable health status. And they can even help with physical and rehab therapy there at the home. So even in the home, right, care relies on some technology. It could be portable infusion pumps, vital signs monitors. It could be oxygen concentrators, and telehealth tools that help connect the patient back to their provider. Again, somewhere along the line, from the manufacturer to the healthcare facility to the patient, the biomedical equipment technician and clinical engineer are there to ensure that the equipment is safe, functional, and easy to use in non hospital environments. The home healthcare extends the continuum of care beyond the hospital walls, where clinical engineering ensures the technology that makes this possible is reliable, safe, and supports patient independence. Hospice represents the model of quality, compassionate care for people facing a life limiting illness or injury. It's more than medical treatment. Hospice is a team approach. It relies on expert medical care, pain management. This is where emotional and spiritual support actually come more into play. All of it's tailored to the patient's wishes and needs. Importantly, hospice extends support to the patient's loved ones as well. Again, at its heart, it's a belief that every person has a right to die pain free, with dignity, and with families receiving the support they need to make that possible. Hospice serves to help the patient in many different settings, right? So it could either be in hospitals, ambulatory clinics, or even in the patient's home. Patients in hospice rely on technology for comfort, like oxygen concentrators. It could be infusion pumps for pain relief, monitoring tools, home based medical equipment. And again, in this healthcare life cycle, BMEDs and clinical engineers ensure the technology is safe, reliable, and unobtrusive, right? So the focus stays on comfort and dignity, not equipment failures. Hospice is about compassion and dignity at the end of life, and clinical engineering supports that mission also by making sure the technology behind hospice is seamless, dependable, and focused on the patient's comfort. There are three main federally funded healthcare institutions in the United States, which are the Veterans Health Administration, Military Health System, and the Indian Health Service. And let's talk about each one of those. So, the Veterans Health Administration, this serves veterans across the country. So, those in the military who have served their contract honorably and require medical attention. The Military Health System, this provides care for the active duty service members and their family. And then we have other systems like the Indian Health Services. This is focused on delivering care to American Indian and Alaska Native communities. And each of these systems plays a unique role in ensuring access to care for specific populations. And each depends on advanced medical technology to deliver that care. So, whether it's from VA hospitals to military treatment facilities to tribal health clinics, BMETs and clinical engineers again ensure that those devices are safe, reliable, and that they're standardized across large, complex networks, especially if people are moving between networks. So, your work as a clinical engineer supports not only patient safety, but also the mission readiness of these critical federal health systems. Federally funded healthcare institutions serve some of the nation's most important and often underserved populations. So, clinical engineering keeps the technology behind that care dependable and trusted. The Veterans Health Administration, or known as the VA for short, it's the largest integrated health system in the United States. So it includes 153 medical centers and more than 1,400 community-based outpatient facilities. Beyond that, the VA also operates community living centers, vet centers for outreach, and domiciliaries. They're like home-like facilities for veterans with long-term medical conditions. But like any integrated system, the VA provides primary, secondary, and tertiary care, covering the full continuum of health services for veterans across the country. And with such a vast and complex system, reliable technology is absolutely essential. From diagnostic imaging in tertiary centers to infusion devices and outpatient clinics to monitoring systems in long term living facilities. Again, the same BMATs and clinical engineers of the HTM profession will ensure that technology is consistent, safe, and very, very important, interoperable across the entire VA network. The VA is not only the nation's largest health system, it's one of the most complex. Clinical engineering is the backbone that ensures technology across this particular massive network supports safe, dependable care for America's veterans. And again, just to always add one little last piece of information I wasn't thinking of that just popped in my head is that the VA actually has a separate department for the biomedical equipment repair side, and they also have a separate department for the clinical engineering side. So they definitely understand the significance and the importance that each one of these roles offers to healthcare. The military health system is part of the U.S. Department of Defense, and its mission is to care for those who serve, again, service members, retirees, and their families. Each branch of the armed forces operates its own network of hospitals and healthcare facilities. And to make sure care extends worldwide, the system uses something called TRICARE, a program that combines military facilities with civilian healthcare providers, organizations, and other pharmacies. So it's a massive global healthcare network designed to ensure readiness and deliver care wherever service members are stationed. Within the military health system, medical technology again must work reliably not only in large military hospitals, but also in deployed field hospitals, clinics, mobile care units all around the world. Again, BMS and clinical engineers have to ensure that this equipment is safe, functional, and mission ready, often in very challenging environments. The military health system happens to be very unique because of its scope and global reach. And again, clinical engineering makes sure the technology behind that mission is dependable. They make sure that it's supporting the health, safety, and readiness of America's armed forces. The Indian Health Service, or the IHS, this is an agency within the U.S. Department of Health and Human Services, and its mission is to provide health care to American Indians and Alaskan Natives. And the IHS has two primary goals to ensure access to care and to reduce health disparities that too often affect tribal communities. Again, but like all health systems, IHS facilities rely on medical technology from diagnostic tools and laboratory systems to telehealth platforms, especially telehealth, where some of their clinics are so far out there, it would take hours to get to the nearest, hospital, right? So these telehealth platforms, they extend care into rural or remote areas. And guess what? BMET's clinical engineers ensure that this technology is safe, functional, reliable, even in these resource limited or geographically isolated settings. But one more thing to make sure that I mention is that because it's telehealth, we also have to make sure that this stuff is secure. Right? The Indian Health Services, the IHS, is its mission is about equity and access, so it makes sure care reaches communities that have historically been underserved. And again, clinical engineering supports that mission by keeping the technology behind care dependable and accessible where it's needed most. And I'm always going to throw in, not always, but I usually throw in one last little piece of information that kind of pops in my head at the last minute. This is one of those places, the IHS, where it would be like an honor for me to actually work and finish off my career. The Indian Health Services, or the IHS, again, a unique system of care. It combines federal services with healthcare organizations managed independently by the American Indian tribes and Alaskan Native corporations. And care is delivered in several ways. First, the federal system, direct facilities, and then tribal native managed facilities. Within the federal system, it's divided into 12 geographic areas, each working day to day within a unique group of tribes. You have direct facilities, including 28 hospitals, 63 health centers, 31 health stations, and 34 urban projects. Now, these numbers may change based on the time I've done this recording to the time you hear it, but somewhere around there. And then we have tribal and native managed facilities, and this adds like another 17 hospitals, 263 health centers, 92 health stations, and about 166 Alaska Village clinics. Like most systems, IHS delivers primary, secondary care. Some areas also have tertiary care capabilities or contracts for advanced services. And this wide reaching network depends on, you guessed it, consistent, safe technology across a very diverse set of facilities. So, again, biomedical equipment repair individuals, clinical engineers, they support everything from diagnostic equipment in places like rural Alaska clinics to advanced systems in hospitals, often under resource constraints and across vast geographic distances. Think of Alaska alone. Again, ensuring interoperability, which is super, super important for places that are so far apart, not just devices that are located within one particular organization or building. Right? So they ensure that, they ensure reliability, most of all, patient safety in a wide variety of environments, which are both a challenge and, like I always say, clinical engineering is a calling. The Indian Health Services, they reflect a partnership between federal, tribal, and private providers to deliver what they call equitable care, and clinical engineering, the technology that helps run all this. Clinical engineers help sustain that partnership by making sure that the technology behind care is safe, reliable, and in this case, you can very easily understand that the technology has to be adaptable, no matter how remote or resource limiting the setting is. That wraps up this lecture on healthcare settings, the places where care is delivered for healthcare culture and healthcare technology management culture. Right. So, what did we explore? We explored the range of healthcare organizations, those that provide primary, secondary, tertiary care. We defined what continuum of care is, the journey a patient takes from their entry into the system until care is no longer needed. And we look at some of the unique organizations and the relationships between them that makes the system work. So, again, for clinical engineering professionals, the takeaway is pretty clear. Every type of care, whether it's primary care, specialty, or some tertiary center, all of it relies on technology. The biomedical equipment repair technicians who you work alongside with, and other clinical engineers you may work alongside with, it's everyone's job, especially these individuals, to ensure that the technology is safe, reliable, that it's integrated into workflows so that clinicians can focus on patients and patients can trust their care. It has to be where it's just part of the process. It can't deviate them so far from the patient care that their mind is focusing on the equipment and not the patient. Right? So healthcare settings may look different, but they're all connected by the idea of continuum of care. Clinical engineering, again, is the invisible backbone that makes that continuum safe, efficient, and possible. I want to thank you for your time, for listening to these notes, and hopefully you're getting something out of it. Thank you very much for your time.